Hi, I'm Alex, and today I'm sitting here with Dr. Paul Vanek of Menor Plastic Surgery. Dr. Vanek has been in plastic surgery for over 25 years and has his own office, Menor Plastic Surgery and Med Spa in Concord, Ohio. Thanks for sitting with us today, Dr. Vanek.
Thanks for inviting me, Alex. I'm looking forward to this tete-a-tete.
Yeah, me too. You're changing people's lives, and you've been doing so for over 25 years. And I'm really excited to be sitting here and talking to you today because you have such a positive energy. Every interaction we've had has left me feeling better. And I can see in the before and afters with your patients that there's a smile, there's a sparkle in the afters. So you're really doing some amazing work, and I'm excited to sit here and talk to you today. For those of you who don't know, Dr. Vanek, like I said, has Menor Plastic Surgery and Med Spa located in Concord, Ohio, but he has a very impressive background. He's a board-certified plastic surgeon with the American Society of Plastic Surgeons. He's on the American Board of Plastic Surgery, the American Board of Surgery, and he has plenty of affiliations and honors. And I'm going to go through some of those with you. Maybe we can talk about, how those came about. He's a fellow of the American College of Surgeons, the American Medical Association, Ohio State Medical Society. We're going on, and we got a lot of stuff here. The Lake County Medical Society, the Lake Hospital Foundation. He's one of America's top physicians and America's top docs. He's a life member of the National Registry of Who's Who, News Herald Best of the Best Reader Poll, and he's a multiple year winner in that. And he has plenty of residency and fellowships, such as the University of Michigan, where he was the fellow in the Division of Plastic Surgery, the University of Rochester School of Medicine, and the Department of Surgery, the Chief Surgery, Resident, and General Surgery. I hope I'm getting all of this right. This is a lot.
You're doing fine. My mother would be so proud of you.
This is for you, Mrs. Vanek. So he got his Bachelor of Arts at Haverford College, a BA in Molecular Biology, and was a Rhodes Scholar for his excellence in the arts, athletics, academics, and community service. Dr. Vanek, this is all really impressive. And like I said earlier, it's really a great pleasure for me to sit down and talk to you today and do this podcast, the first podcast ever that we've done together. And I wanted to just ask you a quick question. I just went over all this, your background here. What stood out to you as the most, as you sit here today, the thing that you're most proud of all those different, awards and affiliations I've mentioned?
Well, it's ironic that the thing that's not on there gave me such pleasure was going through musicianhood as a young person, and getting my Eagle Scout was a tremendous stepping stone to success. I've had it on my resume since I was 16, and each step along the way for every application and every pathway has included an acknowledgement of being an Eagle Scout, of people who are of great success that were deciding whether I could go on into their organization or I could go on and be part of their residency, their med school, their graduate program, their research fellowship. It's something that has made a big impact on me. So I have to say that's, of all the things I've done, I can hark back to scouting as a progenitor of success, because it taught me step by step that I have to participate and then provide leadership and then strive for excellence. I gave a talk about that some years ago with regard to the steps of climbing Mount Kilimanjaro were likened to the steps of becoming an Eagle Scout, but that one step in front of the other is what makes you climb the biggest mountain in your life, which everybody's got their own mountain, and I've happened to have a couple that I'm still working on.
Wow. Well, I definitely want to get back to the next mountain you're going to climb, and maybe you'll tell us. But so as far as Eagle Scouting goes, when you became an Eagle Scout, I should say, Boy Scouting, how old were you? What age was that when you became the Eagle Scout?
I was 16. 16 years old. And then you go from there, you're then a senior scout, and you become what's called an assistant scoutmaster, in which you're helping to help young people to come up the steps of achievement. And then the leaders, who are all adults, obviously I was still a minor, but the leaders really welcome you into that next level of responsibility, and respect as well, I think was also earned there.
Wow. I mean, those are all great principles that, any life would benefit from. And, I was never a Boy Scout. And I think that, based on what you're saying and what I've heard other people say about the Boy Scouts, that I would want to send my son to that because it's just so important. And like I said, everything that I had mentioned about you, which was a lot, the Eagle Scout was what stuck with you the most. That's awesome. So tell me this, you're a musician. I know you're a musician. I've heard you play, I've heard you sing, you have a beautiful voice. Tell me, what drew you to music originally?
My aunt, who's kind of like my grandmother, she's actually my great aunt, she was a wonderful musician, and each of us, there's 5 of us in our family and my mother. My father was brain injured, so he was not that much the singer in our life that he perhaps could have been had he had a different path. But my aunt brought us to music. Each of us learned instruments. Each of us excelled in vocal, in choir. We all went to states and beyond in Pennsylvania where we grew up. But she got us involved as a young person, and then we sang in church, and then that gave us, in the middle of her living room, that was her stage, and she'd play the piano and make us sing and put on a show for my other aunts and my other relatives. I've just celebrated my 50th year of playing my trumpet in the church. I'm in a rock band. I play in church. I play for weddings and different things and have a great time doing it.
That's
it's
awesome.
A whole other way to change your PET scan of your brain is to learn an instrument and be musical.
Yeah, absolutely. Learning an instrument completely changed my life. Like, I clearly remember the before and after.
That's amazing.
Yeah, I started playing guitar when I was like 10 or 11. And it really did. It changed my life because I felt like I was unlocking some secret language.
It's true.
And it's like now when I listen to music all these years later, I still analyze the music. And I'm thinking, what's that background singer doing? What's that drummer doing? I just love it. It's such a great common language we all have. So what would you say your main instrument is?
It's trumpet and flugelhorn, but I played trumpet for years before I learned how to play flugelhorn, which is a very similar instrument. That's my main instrument.
Okay. And like you said, you sing too.
Yeah.
And, okay, that's awesome. So when you were in high school, were you an athlete too?
I was.
What was
I was in cross country, wrestling, and track, and was better in cross country and track. I'm a half miler, and went to states for cross country.
Nice.
And then also in band and choir. So yeah, I did it all. That's what helped me achieve, because of Tamaqua Area High School. It was a public school in eastern Pennsylvania, and the stepping stone. I think when I look back, you've asked me some other probative questions. Looking back on things, the biggest leap is going from the unknown of small town Tuscarora, which is where I was born, small town Tamaqua High School, and making the leap to a very good college that was going to be able to help me with its reputation to get me into medical school. That was the biggest jump, is from the unknown to what is known in academic circles as a great preparation for pre-med.
Okay, so
I look back on that.
You went into college with the intention of going to medical school?
I did. When I was about 7th grade, I remember, because again, my dad was brain injured, and you've made me think about this. You gave me a couple questions to contemplate before I got here. I remember deciding in 7th grade I was going to be a physician. And when I look back upon it as with the eyes of a 59-year-old, my mother was going through a rough time because my dad was brain injured. There was a lot of uncertainty, and the doctors around her were such a source of intellectuality, emotional support, answering some unknowns, and really even assuaging my fears, even though they were indirect. And I just thought that being a physician was going to give me some tools that I had no idea what they were as a 7th grader. But from that day forward, I was very driven to make the decision to do everything I could to break out of Tuscarora and not work as a house painter, which my dad was, nothing wrong with that, and to go beyond. And I didn't know what beyond meant, but the vision of that was shared by my mother, who was afraid that if I had this vision, how would I afford to break out and go to school? But that's a whole other developmental story.
So are you the first doctor in your family?
Yes.
Okay. Wow, that's amazing.
My brother blazed the trail. He became a pharmacist. My sister was a chemist.
Oh, wow.
My other brother was a molecular biologist, and my other brother's a computer wizard. So.
All science, all STEM fields.
And all of them play instruments, and all of them have a happy life.
Really?
Like me.
Now, do you live in Northeast Ohio now, here in the Cleveland area? Is the rest of your family around here too? Are they spread out?
We're spread out.
Yeah.
We diverged from Pennsylvania and went to the Four Winds. We live in 4 different states. My brother is in this region for reasons of just his own logistics. He could live anywhere. So I said, hey, why don't you come get to know your nieces? And he said, okay. And he fell in love and got married, and he's stuck around. But we'll see how long he lasts in Ohio.
Yeah.
But my other brother's in Florida. I have a sister in Delaware and a brother in Tennessee.
Okay. So everybody flew the coop then?
We did.
And nobody still lives in that small town that you grew up in?
No, and the reason is there's really not a lot of jobs there. It was central eastern Pennsylvania. There are not a lot of academic jobs. College took us from college to our next level of career and our own interests.
Okay. So then, the reason that I want to go into some of this is because a lot of people know you, Dr. Vanek, but I don't know how many people actually know how you got to where you are today. And this episode, we really just want to go into some of these things. I'm really happy that you were, contemplating some of these questions, and I'm learning a lot. And I'm not surprised at all to hear that, when you were in 7th grade, you felt that calling to medicine. I've been in the room watching you with patients, filming, and your bedside manner is exceptional. You're like a very calming presence in the room, with your patients. And I think that's not something you can teach in medical school. So I imagine you must have a lot of empathy, for
I do.
people.
I was a newspaper boy for 10 years. So you would make people happy. You'd take the paper around the back door and you'd greet people. It was a small town. So I got to learn how to talk to people. I think I got those skills from my mother and my Aunt Elizabeth. And it's funny that's very kind of you, that observation. I made a decision. I think being calm comes with having information. And also being calm is that you know where this conversation's going based upon asking the person what their problems are, examining them, which are the tools of medical school and residency, and being able to reassure them that, uncertainties aside, that this is our pathway, this is where we're going to go, and I'm going to help you get there.
Yeah, that's beautiful. Yeah, giving people that comfort of, like you said in the beginning, the unknown, going into the unknown. And a lot of people that are getting procedures done are going to have surgery. There's an unknown on the other side of that.
There really is.
Yeah, but you have a lot of experience and knowledge, so you're making them feel better, and you can see that.
And I try to do that without giving them guarantees, because it's that uncertainty. You have a duality between these are the things I know, and as they talk about philosophically, your unknown unknowns. But we try to stick with the known knowns and the unknown knowns. So having a person express their fears or bring out of them what they're concerned about also helps me to reflect back to give them reassurance about things that we can reassure them about.
Sure.
So in generalities. Well, whether it's a person who puts their trust in me to take a part of their nose off with cancer, or I just had a woman who's so sweet, sent me a picture of herself that she lost her finger and be able to reconstruct her to have a functional hand. Or a woman today that says, make my breast look perky and I'm going to be more self-assured. That's one of the joys I really have of a daily surgeon. It's such a gift that people give me to put their trust into me. I love it, and I don't bear it without the burden that it is, meaning it's responsibility, but it's the burden I'm supposed to bear. As they say, from whom much is given, much is expected. Or is it to whom much is given?
To whom?
To whom.
Yeah, that's beautiful. And I think that, like I was saying earlier, it's very clear that these patients, they find another part of themselves going through the process with you if they're doing a cosmetic procedure. And on the other side of that, there's more confidence. There's almost like you can see it in the after pictures, a renewed hope, or just like a blooming of a person. And it's so beautiful to watch that can happen.
Well, you've helped me to facilitate that demonstration. Your skills have also allowed people to manifest that and essentially share that story with someone who may not have the fortitude at that moment to say, I'm going to take this leap of faith and go get what I want. So thank you for recognizing that, and number two, facilitating and then bring that out of other people.
It's an honor to work with you in every capacity. Let's go back to young Dr. Vanek. Okay? You're in med school now.
Yes, sir.
So were you always gravitated towards plastic surgery, or where was your mind at when you were just entering medical school on your trajectory?
When I was an undergraduate, I did research in wound healing and also Sprague-Dawley rats about neurotransmitters. I have a lot of attractiveness to the molecular biology of mental illness. I worked at Columbia and worked with a great psychiatrist. So there was a short time when the budding process of neurotransmitters was coming into the reality, We found them from the gut, by the way, not in the brain. I was very interested, and I went to New York to study that and do research in it. There, that researcher actually introduced me to a cardiac surgeon because he was married to her. And that was a great enamoring time when I was thinking I'm going to go into cardiac surgery. But one thing led to another. I did more research and ultimately worked out at Cal Berkeley for the Department of Energy. And that was the era of time between the transition of college into medical school that I realized that cardiac surgery did not have the diversity of procedures. And now you ask me a question, what are my formative bases? Because I was a musician, I looked at learning the arpeggios as a musician would be me being a medical student and then a resident. But playing the music was what I was looking toward, where I would have a diversity of procedures. I would not be playing the same tune all my life, meaning heart surgery, valve surgery, CABG surgery, although cardiac surgery is incredibly interesting and incredibly challenging. I have to say that musicianship made me realize I wanted to do more than one thing every day, and that in the morning I can do the body at the head, I can work on the trunk, I can work on the foot, I can work on a baby, I can work on the hand or the foot, I can do free flaps. Unbelievable diversity that manifests itself when I was doing wound healing research at Cal Berkeley and NYU. So that diversity thought process of arpeggios as a formative talent in music and playing the music as a musician who's formulated, really now as a 49-year-old, that's what I've processed, but didn't know it at the time.
Interesting.
I did not know it at the time, but thank God I realized that I wanted to do something different every day and didn't want to do the same thing every day. And Rochester, New York, where I was resident and chief resident, gave me the tools to recognize that I could have such a career.
Wow. Yeah, I can imagine. I mean, it's so exciting what you can do for people. And like you said, I never thought of it like that, in terms of, the diversity that you can work on, someone's face, their body, their back, and really what's also interesting too is the reconstruction. I could see how when you're seeing the wounds, from, I imagine, car accidents or accidents or
cancer,
or even just cancer, disfigurement from cancer, that you can go in there and do that restructuring, surgery. So is that what you would say that you love the most about your career?
I do. In the 80s, the breast reconstruction was coming into the fore with using the patient's own tissues. And when I was a young man, when I was a boy, one of my aunts used to wear a birdseed bell in her chest because she had a mastectomy, and she's a big Irish lady, and she's like, somebody should be able to do something for this.
What's a bird? What did you say that was?
A birdseed bell.
A birdseed bell.
You go to the store and you have a bell in the shape of birdseed that's crushed together, and you hang it up, and the birds come eat the bell. She was wearing that in her chest.
Really?
Because it kind of looked like a breast.
Oh, wow.
Which is absurd when you think about it. Now we have silicone inserts and we have prosthetic breasts. This was all in the 70s. It was before that was all available, at least in rural Pennsylvania.
Yeah, right.
But that was not a call to arms for me, but it was one of the things when I look back on was breast reconstruction was evolving at the time with expansion and with tissues and implants and flaps. And in '84, a guy developed a technique where you take tummy from your stomach and rotate it up on a muscle and make a new breast out of it. It was incredible. And it was a revolution in plastic surgery.
Is that considered a fat transfer?
No, fat transfer is when you harvest it in a syringe and you transfer it in a liquid form like a graft and plug it in there. No, that would be called a flap, where a muscle or a blood vessel is used to transmit an island of tissue that then lives viably. You can either detach it and plug it into vessels where it's going, or it can be connected and rotated from one point to the other. That's called a flap.
Interesting. Well, I mean, you've seen then a lot of different changes over the years. Like
immense.
From when you first came into now, how different is the field of plastic surgery?
It's exploded. If we look at our literature, that the diversity of cases, the amount of molecular biology that's involved in plastic surgery. If you recall, a Nobel Prize winner for kidney transplant was a plastic surgeon. That was done because the person thought, I can take this principle and that principle and put it together. Again, take the arpeggios and make the music in a different way. I don't want to take any credit for any of that. I'm one of the citizens of about 6,800 plastic surgeons in the United States. But I do keep track of things, and I try to use our literature. But it gives me, as a plastic surgeon, the diversity to do A, B, C, D, E, F, G. And not that I'm master of none, I've become a master of many things because of keeping track with things, keeping in symposia, and learning things from the other masters of the country.
I'm going to ask a totally random question. Okay, so your background in neuroscience, or your research in that area, and plastic surgery, do you see a connection between how one perceives their own body and their mental health?
Absolutely.
Yeah?
Absolutely. And we've studied this too. Patients who have been asked if they're depressed or anxious, if you had $10,000 to spend on Freudian analysis or $10,000 to spend on plastic surgery, 91% of them choose plastic surgery. The psychiatrists did the research, not the plastic surgeons.
So why do you think that is?
Self-esteem or self-image is integrated into positive affirmation of self. So a person who's got a hang-up of something that may not be what you and I would say, oh, I don't like that attribute, the person has an internal narrative that they don't like. And if there's a possible way to alter that narrative by artful and subtle and realistic looking plastic surgery, the patients really want that. We see these absurdities in Hollywood and in the media, which is not my jam at all. I don't keep track of it and don't really care. But taking a person who's got a self-esteem issue about a certain thing is the perfect patient to have surgery. Because if you solve that, they usually have all other fronts as well-formulated psychology. That's just the area that bothers them. That's what I'm actually figuring out as I'm talking to people is, if I intervene on them, am I going to create for them other problems from the results of the intervention? Number two, if I intervene on them, will they be happy? Can I figure that out in advance of doing the procedure? Will they be happy, and will I bring them happiness? And that's one of the existential and ethereal things that I think I do. So your question about psychiatry or psychology, I am not a budding psychologist or psychiatrist. I do actually work on the soul and the heart, and I love that about my job, and I take it seriously. But I'm trying to work on the physical and the mechanical aspects of things to hopefully bring them some solace and peace and happiness. And that's one of the greatest benefits I have in my practice, is to bring them to that end point if I can. Wow. With nurturing too.
Absolutely. You articulated that so well. Of what I was trying to say earlier is that glow that I see in the after photos or any of those videos. It's almost like a part of their, someone's soul or their being is more aligned. Have you found that after successfully doing a cosmetic procedure or not cosmetic, if somebody had a wreck, do you find that their life does get better? Their mental state, their psychology, does it improve?
Absolutely.
Yeah.
Absolutely. It's and depending upon where they're coming from. I mean, a recent person who had a very sad period of life, lost their daughter, their spouse passed away. They worked to lose 138 pounds and transform themselves into a healthy lifestyle, but they're left with a body and face that's just not reflecting the soul and the wit and the energy that took to overcome that.
Sure.
And she enabled me to do facial rejuvenation surgery and body contouring and breast enhancement. And, big effort with her part. She had to go through all of that recovery, but she just is soaring, and she's such a wonderful person. The affirmation she gives for me is greater than, I think, the affirmation my staff and I have given to her to come through all that period of time. Yeah. And I have a lot of examples of that in my life. And it can be as small as a scar on the side of the face that makes a person so self-conscious that we can do something with lasers or other technologies to make that more acceptable to them.
I'm going to ask you a more philosophical question, if you don't mind. Why do you think that does why do you think a certain self-body image or like even like a little scar, why does that bother people so much?
Well, I think we know that attractiveness is a biologic entity. Think of birds that have male plumage to attract a mate, or think of the animals that have horns that demonstrate their prowess, or plumage of bird species are classically studied. But the size of things is not always the greatness of it, but the appearance of the individual species is very much ingrained in the neurology of self-image and the character of the person, namely, not that they're good or bad people, but the character of that I am conscious and courageous enough to go forward in life. I think it knocks people's self-esteem down to have something that they say, I want to cover my nose, I want to cover my teeth that are crooked or not the right color. Yeah. Now, why that is taken on its own life with media and with advertisement for toothpaste and combs and hair gel, that's a whole other marketing thing. Yeah. But still there's an intrinsic value system of the individual person that says how I appear to others is an important societal value system. So I don't want to be too analytical about it, but we know it's biological, that how we feel about ourselves is then reflected back to either being reclusive and staying in our homes or being effusive and striking out in the world and just doing great things for your own, living your best life, as they say. Yeah. I do see that people say, well, this may not bother me, this observing physician. I sometimes take people on with that and say, this is a very small thing. I know it bothers you. I don't know if the intervention is going to be worth the outcome improvement relative to how I neutrally view the attribute that they're criticizing so much.
So will you then, if a patient comes to you or a potential patient and they're going through the consultative process, will you say to somebody, I don't think this is the right path for you to go down. I don't think you should get this procedure, or?
Every week.
Do you really?
Every week. I have people that I show them their small asymmetries that are bothering them and say, look, that is in totally the realm of normal. We're not going to go after fixing that. We'll fix the plank in one's eye and the splinter in the other, as they say in the Bible. Yeah. We can take care of the planks and we can leave the splinters for another time. But I also tell people don't want to do that and walk them back from something that they may have in a spectrum of dismay. It's a small thing, but once we start knocking down the other items, I want them to take that off the list, not even try to do some things. And I counsel people to do that on almost every consultation. This is a good thing, we can do this, these are the realistic outcomes, here's the photographs, here's the recovery, here's the scar, here's the trade-off, as it were. Sure. And then here's other things that are bothering you. We're not touching that. See how that's on her, on him? Leave it alone and it looks fine. If that's a deal breaker, then we part as friends. They don't have to do anything. I usually also tell that person, before someone else is not going to take my advice to you, I'd like to hear from you again. I want to invite you back to review why you're going to pursue this elsewhere. Interesting. Because I don't say that I can't handle it. Yeah. I tell them I don't think you should take it on.
Has anyone ever taken you up on that, where they decided to go get it elsewhere and then they came back and talked to you?
It's the arc of time. I've been in practice a long time. I have patients, not that I give them recrimination if they went elsewhere to pursue their dream. I just say, well, we're here now. I don't say I wish you didn't do that. I'll say let's take this on, and yes, the answer is yes. The longer answer probably is with talking to my colleagues in plastic surgery. When they see those patients from another qualified plastic surgeon, they also respectfully say, I wonder what he thought at that time before they go forward. Sure. So that's sort of being a collaborator, even though you're not directly in communication with the other person, the other plastic surgeon. Sure.
Wow. So I guess one of the questions that I have now is there anything in the field of plastic surgery that frustrates you? That people are doing or other plastic surgeons are doing that you wouldn't do? Or is there anything, that's frustrating to you?
I wouldn't say frustrating. I think there's some things that are inartful, and that's a matter of quality. Sure. Somebody that does eyelid surgery, for example, if they don't know how to manage the lateral canthus and they make people have distortion of their eyelids and their facial appearance, that's a frustration to me, because as someone like many of us, we're pursuing excellence, naturalness, and we don't like the value system of somebody that has distorted appearance when they're done with surgery. The goal is to make the person naturally beautiful, restore them to their best natural beauty. So I think one of the frustrations I see is the patient's expectation it's going to happen in 4 minutes from the end of a needle. Right. And so there's so many posers that say, I'm a plastic surgeon or I'm a cosmetic physician, and they don't have the training. That's a bit of a frustration, but then it's just simply the market in the United States is that people can say, I'm a rocket scientist, but all I do is shoot bottle rockets. Right. That doesn't mean they really rocket science.
And that's where that board certification is so important.
That's true.
So what would you say to somebody who's researching, for a plastic surgeon? Of course, if they're in the Cleveland area or if they're out, throughout the whole United States, you can come visit Dr. Paul Vanek. But if they're somewhere where, let's say, they don't have access to you and they're researching plastic surgeons, what should they look for?
I think the first thing is credentialing from whom. And the credential that's the real deal is the American Society of Plastic Surgeons. Only board-certified actual plastic surgeons are allowed in that society. They're the arbiter because they have their own residency that's dedicated solely to plastic and reconstructive surgery. So patients that may have been told that, well, I'm board certified in cosmetic surgery, there is no such thing. You just pay $500, you can get a certificate from the American Board of Cosmetic Surgery. It doesn't matter if you're a family doctor, an ER doctor, a dermatologist.
People need to know that. That's important.
I agree with you. And that's something that is a difficult haul because a person who may come in who may or may not be happy with their outcome, but didn't know that they put themselves in the line of fire of somebody who did not have true credentials to do what they say they're doing. I see ENT doctors and urologists that are doing different things because cosmetic surgery is now transitioned to mostly self-pay, and insurance companies are hammering the reimbursements for physicians of all specialties.
Right.
And we're seeing this in coronavirus. The nurses and doctors, they want to get out of medicine that's through the pathway of healthcare insurance reimbursement because that just keeps continuously getting pushed down to a lower number every year. Cosmetic surgeons or doctors who are plastic surgeons that do cosmetic procedures, obviously we make a good living. We do.
Sure.
And so there's low-hanging fruit that's there, injecting people, giving them cosmetic treatments, laser treatments. These are also driven by technology companies who will sell their products to anybody that's not including just plastic surgeons. So there's a lot of market forces at work. That may be one of my frustrations, but it's one of those things. It's okay.
It's reality.
I tell people, don't get the electrician to do your plumbing work, or vice versa.
Right.
I just have fun with it.
Yeah, well, and that's why I wanted to bring that up because I feel like there are some people who are going to a doctor who it shouldn't necessarily be. They don't have that board certification. They're not necessarily going to give them the result they're looking for.
And that's what's difficult is because we don't want to be throwing stones at our colleagues who are also trained for medical school and did their own approved residencies, but they're out of their lane and we just sort of leave it there. The patients that we try to see, we say, you're here now. I'll help you try to do my best to give safe passage. I can give you no guarantees of all of the possible outcomes that are possible, but here's some track record effects of other surgical decision-making and other patients who went through this pathway. So I feel obligated as a plastic surgeon to not be in the face of the patient of what happened before, but I just try to pick up their hand and say, I'm going to guide you as best I can from here forward.
Right.
Don't try to look into the past. Stay positive. We're going to go forward in the future together.
Yeah. Well, do you fix then some mistakes that people have made in the past? Is that a common thing for someone to come to you and say, I've had something done, it didn't turn out the way I'd like it? Would you be able to fix it, so to speak?
Well, I take again, in the context of taking them by hand, I start with the notion, all right, it didn't go as you hoped. I try not to get out a stick and flail on the outcome or the person or the previous practitioner. As a kindness to the world, I think it's better to say, you're here now, I think we can do this, or I don't know if we can go back. And I try to take them in an academic way, in an anatomic way, in a physiologic way, in a surgical principled way, to say what's next for you and see what's realistic.
Does a lot of the success of certain procedures rely on the patient's own follow-up and following your instructions?
Some of it, yes. Most patients are going to say take a couple days off, take a week or two off. There are restrictions, like if you break your leg, you need to not be going skiing for a while.
Right.
I mean, they're specific.
Yeah, you shouldn't go out and go tanning after you just got a facelift.
Yeah, but a person's cooperation is absolutely integral to good outcome. Having a person who goes off the reservation is what I joke about, is if they're just going to do whatever they want. I try to also figure that out in advance and say, look, I need your cooperation for this finite period of time until you're properly healed, until the things that we put together have had a chance to sort of calm down. If I don't get that buy-in, then I just take a pass and say, look, you're a knucklehead. I can't fix your tendon because you won't hold your hand still until we get things to heal a little bit.
Well, I imagine lifestyle matters too. If they're a smoker or if they drink a lot of alcohol, that probably would affect the outcome, the healing.
Absolutely.
Yeah.
So those are the things that, as a physician, you put your physician hat on and say, these are lifestyle decisions you're making that are going to negatively affect you. If you have a gallbladder attack, you're going to the operating room, it's an emergency, you deal with that person wholly in the moment and say, I'm taking out your gallbladder, we got to see how it goes. But when we're trying to select patients for elective procedures, it is a pas de deux, a dance of two in which the surgeon and the patient have to have a cooperative relationship. There are certain premises for engagement, and then there are certain engagement rules for the aftercare, all of which I include as part of your understanding of the surgery. It's not just the procedure day, but there's a whole follow-up sequence that I give. And I love seeing people post-op, so it's one of the things I really enjoy.
Well, yeah, I can see why you would enjoy that. I would probably enjoy that too. And you have such a great staff too, that I'm sure it does a lot of follow-up. Completely pivot in a new direction now.
Go ahead.
So you just opened up a new office in 2020, in July of 2020. And you moved from your Menor location, which was a part of, was it Lake Health?
Yes.
Lake Health building? And now you're in a standalone building in Concord. So it's been about a year and a half, right, or so. How is it being in your new location?
I absolutely love it. It's changed my life. Every day I walk in there and I pinch myself a little and say, from where I lived with my mother and my brothers to this beautiful place. Ritz-Carlton is a quintessential place of beauty and excellence. And I just think my staff and my environment, how we decorated it, how we think about the program, you turn left, you turn right, all things are programmed and we had time. One of the negatives of coronavirus is that it was like, am I going to get this construction sequence done and be on budget? But one of the positives was it let me think about program with the architect, with the decorator, with the builder. We really put a lot of time and effort into such a great physical plan. But so the short answer is love it, so happy.
It's beautiful. It really is. It's such a nice environment. Your old office was nice too, but this is just like really, really captures your personality. It's the medical spa side of things there is so beautiful. With the you have that really nice steam shower, you got the foot soak area, you have massage rooms. It's really a great place for somebody who isn't even getting, like a surgical procedure.
Right.
They can go there and they can get facials and they can have a massage and it's just, I love it. It's beautiful. Well, that's great. So, okay, when people find out about Dr. Paul Vanek, and they're interested in you, what is the consultation process like? What can someone expect if they're interested in learning more about what they can do with you?
Most people find out about us word of mouth, about half of people, which is fantastic. Other people come through the website with some of the efforts that you've made, and they usually contact us through the website or make a phone call, which is always best because we like to pick up the phone within 3 rings and you're speaking to a real person. We don't like voicemail. They set up a time, and usually my cosmetic coordinator, Mary Jo, will have a conversation with them about what their overall goals are. But the day of the consultation is already into the journey because figuring out what's the timing, what your goals are, honing some things, Mary Jo will help you navigate. When it's game day, you and me and the mirror, or you and me and whatever else we're talking about, then the game day is just a discussion about your specific attributes, what you were trying to accomplish. I try to listen carefully, take a medical history, do a clinical examination, and so then we make a formulation of what's for you. And I put that together with lots of photographs of other people. And I've been very blessed that patients have given me photo consent, so I can kind of harken back like, oh, this feature of your nose, or this body habitus or skin type. Ironically, a few days ago, I saw a woman, she's 31. I was showing her a picture of, because when I looked at her, she's bothered by her nose. We looked at a host of pictures. The second person I showed her, because I have an array, and I just sort of picked somebody and opened it up. She said, oh, that's my sister from 14 years ago.
My gosh.
So I was like, that's funny. You didn't tell me that. But that's the kind of thing that the features of a person, because I have a good memory, I can use that to teach them about their nose, or if the person has this or that feature or their history. It's been great. It's been a great journey, and I have a good memory, so I like to keep that in mind. But that's a little vignette yet that I've never told anybody.
That's awesome. I never heard you say that. Is it hard for you to turn off the plastic surgeon in you? Like if you go to the store, if you go somewhere, I mean, are you looking at people's noses and stuff like that, or can you just turn that off?
I turn it off. Okay. I'm more focused on being with my spouse or my friends, and we're talking about day's events. No, I turn it off. If somebody asks me a question or we're watching a show and oh, that person has this, I'll say, yeah, they have Apert syndrome and their eyes are separated. And there's a lot of syndromic things in the world that are in a spectrum. So having the names to them was the second sight that I thought I would learn when I was going into medical school, is looking at somebody across the room and saying, you have kidney disease because your skin looks like this. And you have this gait disorder because you have the spinous process that's going on in your life. Those are the things that I have such gratefulness that I had people that instructed me and helped direct my reading and intellectuality. But do I turn it off? Yes, I do, for sure. It's exhausting.
Yeah, otherwise I can imagine. But I can also imagine people ask you for opinions a lot.
They do.
Not in a professional setting either.
That's true. And I try to be sweet about that. But think about a musician that goes through the day and every music song he hears, he's not analyzing the chord progression or whether they forgot to play A flat instead of A natural. That's something they just enjoy the moment.
Sure.
And I absolutely look at it that way.
Nice. Yeah, I can see that, because for me as a musician too, going back to talking about that analogy, it's like I really like when I hear a song I really like, I'll listen to it over and over and over again. But a little bit of the magic could be lost when I actually dive into learning the chords and the sequence and all that kind of stuff. Not magic, but it changes the relationship. That's true. So I could see why maybe you wouldn't want to analyze every face you see or whatever. That would be like, man. Okay, a question about plastic surgery now. Yes. Somebody who is a young resident, or they're thinking about becoming a plastic surgeon, they're in medical school. What would you say to somebody that's pursuing that?
I would say that if they're a fine arts minded person, that they need to really think about how much we're using physics and energies, radio waves, light waves, and also biochemistry, immunology, bioactivity. That those are the new normal for plastic surgery. Many of the things I'm doing right now were never even invented, but they're primordial thought processes where if only I could take this magic wand and change the physical appearance of something with a little 3 millimeter incision. Well, that's called ultrasound vaser or Tesla energy using radio waves and helium plasma. So being attuned, I'm very blessed to have gotten in through the Department of Energy and NIH and DOE and Navy funding. Having that background in radio waves, radio frequency radiation, it's incredible how much of an understanding I have of what's the current forefront of plastic surgery technology, because the minimally invasive and non-invasive energies are where we're going to be making people rejuvenated. We will still be doing surgery in 50 and 100 years. I do predict that because there are specific things that we're able to do as surgeons that is no other intervention is going to
like
manifest.
Massive weight loss or something like that.
Correct.
Yeah.
So, but there are also going to be continued innovations in the area of using radio waves, microwaves, energy beams that are coming, that are very well physically described already, and how they come into clinical use is the next 10 and 50-year horizon for us.
So do you think, I've been hearing, doing a little research, I've been hearing a lot about spinal stem cells. A lot of celebrities are using them for regenerative reasons or, for cosmetic reasons. Do you see that as being something that plastic surgeons would utilize in the future too?
We already are. Okay. We utilize the stromal vascular fraction, which is we harvest it from fat and we inject it into places like the face, the lip, the irradiated breast, the contracted arm or hand. And I've done those kind of cases, and they're very gratifying. There are a recent publication even from this week is that when we stratified people that have post-radiation breast pain, that when they broke them up into control patients that didn't get fat and those that did get fat, they saw no differences. But that's not to say that my colleagues and I have not taken fat transfer, harvested from the patient, put them into the tissues of the person that are been traumatized and seen very dramatic improvements. So there, even though there's some negative studies, there are beyond anecdotal outcomes that make a difference. The transfer of tissue from one place to another has some magical properties. Really? And it's not all perfect, but it certainly makes a difference over injecting them with external agents. We're purifying things on a molecular biologic basis. But if you think about an orchestra, the pure trombone section doesn't make the music. It's the interaction of all of the instruments as one symphonic event. Now bring it back from symphony to biology. Taking fat cells in multiple cells architecture and injecting them into a tissue is different than isolating one single cell and putting it as a bioactive agent. Our biology works in concert. It's not solo actors. Solo actors do things, but they work in concert as a symphony works in concert. Wow. So that's one of the things I use to explain to patients why we're doing certain things. That doesn't mean we can't give you insulin and get an insulin effect. It's one molecule, or Botox and get a Botox effect. But we're doing things now that are biologically active, and it's fantastic.
Wow. And that wasn't even a thought probably when you first started?
That's true.
Wow, amazing.
That's true. When we implanted little vesicles under animal skin, when we did animal research, because humans are too hard to get them to cooperate. Yeah. I'm kidding. But we would harvest that fluid and then analyze the molecular biology of that fluid to see what were the biological activities going on. And it's like looking at the stars. You're looking from far away, and then you got to figure out with electron microscopy, which I did when I was in college, and look molecularly with biochemistry. That's what's so exciting about it, is blending all the way up to all the way down to the infinitely small things.
Okay. So what is Dr. Vanek? What do you do? What do you do for fun? And we know you're a musician. We know you spend a lot of time at the office changing people's lives. But what is something that you like to do for your own enjoyment?
Yeah.
You know?
I like to read, ironically.
What are you reading right now? Anything good?
I'm reading it slowly. I'm reading The 6 Things That Got Us to Now. Number 2, I'm reading a book that's called hold on, I'm blocking the name of the book. It's the Jekyll Island. It's about the Federal Reserve. Okay. The Federal Reserve book is maddening in 1908 that politicians and bankers got together to essentially take all of the government debt and give our money away to other countries and make the taxpayer pay the bill. Wow. And that's where we've gotten inflation. Why was a hamburger a nickel in 1908 and it's $5.50 if you can get it in 2022? Wow. The Creature from Jekyll Island. That's a book that will make your head explode. Wow. I read multiple books at the same time, so I'm also finishing up after a long time never mind. We'll go on.
Well, they're definitely not romance novels, paperback. You're reading some pretty intellectually heady stuff, which is exactly what I would expect.
I also like to walk the dog, look around, see the leaves, grow orchids, and think about plants. I like photography, and not just clinical photography, just going on trips and taking pictures of nature and phenomena.
Yeah, and you've been on safari, and I've seen some photos in your office of those. Those are photos you've taken?
Yes, sir.
Wow, that's great. That's great.
Yeah, Canon T2i.
The Canon T2i.
It's a versatile camera.
We need an endorsement. Canon, if you're listening, we'll take a couple.
I'm seeing a Canon over there. The guy's a genius.
So I guess one final question before we wrap things up that I want to ask you is, have you had any mentors in your life, or anything that you can think back on and said, that this person gave you some wisdom that you carry with you now that you'd like to share?
I've had many mentors, and I call them the silent porters of our life. I metaphorically talk about that, the people that help you carry your loads to the top of your mountain. You don't know their names. I know many of their names. Haskell Newman just passed away. He was a great mentor to me when I was a University of Michigan fellow. I have had other mentors along the way that were in and out of medicine that I've tremendous benefits from. Michael Zubek helped me make decisions that I didn't know. He was a NASA scientist, and then he was an engineer, and then he became a mortgage marketing king and became the CFO of McCormick Foods. Oh, wow. But I mean, people that guide you along the way, they don't always know your vertical or but they understand success paradigm, and they also can ask you probative questions that challenge you as to whether you think you're on the path you want to be on, or are you on the path you think you're on? So
that's invaluable.
It is invaluable, and for that it's been a great blessing. Also, Father Vincent York, who's now Monsignor Vincent York, has been a tremendous icon in my life, from both iconic intellectuality, but also spirituality, and just a great human being. Gives me great hope for the future of our world.
Well, we need a lot of hope right now. And like I said at the beginning of this podcast, every time I see you, Dr. Vanek, I feel better. You bring a lot of positivity into the room, and I thank you for your time. If we do future episodes, which I hope we do, we can talk about some more specific things, procedures and, different topics you'd like to discuss. But again, thank you. So again, this is Alex, and I'm here with Dr. Paul Vanek of Mentor Plastic Surgery. Make sure you visit his website at mentorplasticsurgery.com. Follow him on his social media. He's very active on Facebook. He's very active on Instagram, and we're getting on TikTok too. So follow us on there. And I also invite you to please comment so that we can get to your questions, because Dr. Paul has a vast knowledge, and we would like to get some of that out there. So ask questions, and again, thank you.
Thank you, Alex.
Thanks.